The United Nations says there is no scientific basis for travel restrictions and quarantines on health workers returning from West Africa. A judge in the U.S. agrees, rejecting a legal request to limit the movements of a healthcare worker who returned from Sierra Leone. CCTV's UN correspondent Liling Tan is in New York with more on the controversy.
As New York's first and only Ebola patient, Craig Spencer, remains hospitalized in serious but stable condition, a judge in the U.S. state of Maine has ruled against putting nurse Casey Hickox under mandatory quarantine after she returned from Sierra Leone a week ago. The controversy over how to handle medical volunteers returning from West Africa continues. The governors of 3 U.S. states, Connecticut, New York, and New Jersey, have sought stricter measures than the Centers for Disease Control recommends.
There's no scientific basis to restrict the travel of workers who've been giving service in the affected countries. There's no scientific basis for putting them in quarantine unless there is a suggestion that they might have Ebola. So if they've got no symptoms, please think very hard before putting restrictions on them.
Doctors Without Borders, the French medical group working the front lines of the Ebola epidemic, says the strict quarantines have had a chilling effect on health workers in West Africa who are afraid of what they face when they return home. Meanwhile, the rate of Ebola transmission in West Africa appears to be slowing in some areas, though it remains high in others. The UN warns against assuming the situation is now under control.
You do not always each week have a timely production of the full data, so we are checking to see whether or not the data are a reflection of what's actually happening.
Dr. Nabarro said that the data suggests that the current Ebola strategy is the right one, but there's still a long way to go before the outbreak can be said to be under control. Liling Tan, CCTV, New York.